So Charlie's come in today for shoulder pain. Charlie's a tennis player and he gets pain into his shoulder. So that's what we're going to be addressing. And we've established that in the consultation. I've also checked with him before I've started that he's happy for me to do other things such as dry needling and cupping, and he is, so that's fine. So now that we've established what we need to get from this treatment, I'll just start off by doing a general massage. I just really want to feel the areas that he thinks are tight and also areas that I find are tight, and they can be different because you can experience referred pain. So we just start off with oil, with a general massage, just feeling the areas, trying to work out which bits of the muscles are tight and which are not so tight. So you can tell tight muscle because it flicks. So they say that happy muscle is smooth muscle. So tight muscle, you can literally see it, and you'll certainly feel it, where it flicks over. And that's the tight muscle fibres. They're taut, they've contracted together, and for whatever reason they're not releasing. So all the blood can get caught in there, and we need to push that blood back towards the heart to get the oxygen and the nutrients back into it. So once I've done a general kind of massage of the area, we're going to start with some dry needling. So dry needling, the most common question I get asked is, what's the difference between dry needling and acupuncture? There isn't a huge amount of difference. We use the same equipment. Acupuncture tends to work on meridians, which isn't the same with dry needling. Dry needling is much more about going into a myofascial trigger point, myo being muscle. So we're finding these areas of tight muscle because it's flicking underneath my thumb. And then what we're going to do is we're going to insert a needle, a very, very fine needle, into the area, and that will allow the muscle fibres to relax and therefore hopefully ease the pain into the shoulder. So start off with that by just getting one of the disposable needles. Charlie won't really feel very much when it goes in. It's not a painful process really at all. What we're really sort of aiming for is to get a little twitch in the muscle. If you can see with my thumb here, it flicks, and that is the trigger point. So that's where I'm going to insert the needle. Just with a tiny tap, we're going away from the lung area. So we're going to take the needle this way, and we gently insert, checking with our client that they're okay. Does that feel all right? Yep. And we're just going to go backwards and forwards slowly, changing direction. Now what the client will generally feel is like a dull ache radiating from around the point of the needle. Now that is tight there. So what I'm doing here is twisting the needle, and that twists the fascia around it and therefore stretching it out. I can feel there's slight restriction there. And then just go back to inserting into that trigger point. So that's one way that we can deal with pain, and there's many benefits of dry needling. So that's the first way. There's the other way, or the other part of the treatment that I can do, is cupping. Cupping is a very, very ancient art of massage therapy. There's nothing new about this. There's different sorts of cupping, of which I do all three, but massage cupping, I find, is quite relaxing. It's the complete opposite to massage, in as much as the suction that's caused is actually pulling the muscle and the fascia up. So what it's doing, instead of me applying pressure and pushing down, I don't know if you can see, there's a vacuum in there that pulls the muscle up. Now what you'll see happen is very, very quickly, the skin will change colour and it will go much redder. And the reason for that is that because we're squeezing, we're drawing the muscle up, it allows the blood flow underneath to really start circulating. So it's fantastic for kind of elimination of toxins. It's really good for relaxation, great for circulation, really gets the blood in there. So that's one method that I can introduce during a massage. Another method is something called dry cupping. Now this again is a very ancient treatment, but has been resurrected, I'm sure, as you've seen during the Olympics, with people that have marks, circular marks on their body. Now, it comes, really, I learnt it from traditional Chinese medicine, but I don't use it for that reason, because that tends to deal with internal organs. I use it for pain relief, because what it does, as massage cupping does, it causes a vacuum, and that vacuum basically stretches the muscle and the fascia, and again massively promotes blood flow. It's a really great treatment actually for people that have blood pressure problems, because it allows room for the blood flow. So you can, you'll see it done in different ways. It's very common to see glass cups and fire, but I don't use that in the clinic. This is just as good and probably much more simple. So we've sort of established that obviously Charlie's pain is in this region here. This is where his trigger points are. So what I'm going to do is basically just suck up like that. Now what you'll see is the skin, the muscle and the fascia coming up into the cup. And very quickly you'll see the area changing colour. Now we leave these cups on depending on what kind of colour they're going, for anywhere between maybe 5 to 15 minutes. Now this treatment will leave marks on your body. Those marks can last for anything from, say, 3 days to a couple of weeks, sometimes even longer. It actually kind of depends on your circulation. If you have good circulation naturally, then the marks tend to disappear much quicker. It's a fantastic treatment for improving circulation. And when you improve circulation and blood flow, then all the lovely nutrients that come out the heart, in the blood, they flow to these areas. So you do get left with marks. Those marks aren't bruises. They do look like bruises, but they aren't. They're just basically bringing blood to the surface. And as we know, inflammation is one of the first stages, well, the first stage of the healing process. So by allowing the cups to do their work for say 5 to 15 minutes, and we could put more on that area if I felt that it needed it. Quite often I will actually continue to massage while the cups are in. Works brilliantly alongside dry needling. You can do both in the same treatment. And we're just going to, as you can see, they're changing colour. We're going to leave those on for longer, and you'll find that the marks will either go a bluey, purpley colour, or they'll go more of a sort of red colour. So we will just carry on with the massage, leaving those on. Obviously, if your client is feeling any kind of discomfort at all, we take it off straight away. So we definitely need feedback from the client throughout the treatment. But that's basically what you can expect from a massage with me. It's quite rare that I will only ever just do massage. There will usually be something else involved, again depending on what the client has come in for. If it's for relaxation, obviously it's quite nice just to have massage done and possibly the massage cupping. But if it's actually for pain relief, there are many other things that we can do as well to aid that, being obviously the cupping and the dry needling.